This year in our country, over 12 million people have been infected with COVID-19, and now well over 250,000 people, 250,000 people have died in the United States of America this year from COVID-19. In South Carolina, I know you follow the numbers, but we're right at 200,000 cases since the pandemic began, and we're close. We'll probably hit it today. 4,000 deaths in the state of South Carolina. So despite all the things that we're thankful for, we're still very concerned about this virus. And yes, there's great reports about a vaccine coming. We can see the light at the end of the tunnel, but we're not at the end of the tunnel yet. We're not there yet. So we need to continue to be safe. It's not yet time to let up in any means. Now, I'm going to brag on Charleston a little bit. We've done better than most, and I'm very proud of our citizens taking precautions and being safe and trying to be healthy. You can see from this chart over here the growth rate of new reported cases. This is in Charleston County, that we had the huge spike back in the summer after this thing got started, and as we continued through the fall, our growth rate has been marginal, very flat here, the green line that you see. So we're in a good spot. So let's not blow it, y'all. Let's keep our numbers down and in the right direction, and that's how we can keep our economy open and to recover most robustly. So I'm going to call on Dr. Cole in just a second. I do want to share this thought with you first. Governor McMaster last week gave some very sound advice, which was test before the turkey. And that's great advice, particularly if you have a family member or guest coming from out of state, somewhere where there was a hot spot and there were big case numbers going on. That's great advice. Not everybody's visiting from afar, and not everybody's going to get the test done. So if you can't test before the turkey, let's think before the thanks. Think before the thanks. Think it out. How are you going to space things out? If you got a beautiful day like today, boy, let's celebrate outdoors where we can have a little more room and fresh air. It's in those confined spaces, they say, that the spread of the disease is higher, right? So let's think before the thanks. How are you going to space folks out? Can you do it outside? Always wear a mask when you're close up to other folks. Watch your distance. Watch that hygiene. All those basic things that our healthcare professionals have been saying all year. And so now, without further ado, speaking of healthcare professionals, I give you the professional, Dr. David Cole from the Medical University of South Carolina. Doctor?
Thank you, Mr. Mayor. I want to start by thanking everybody in this community who has done their part to help stop the spread of COVID-19 and for encouraging people in your life to do the same. I believe it's made a real difference. Certainly if you look at the numbers there, it certainly supports that statement. Since we came together to face the July wave, we have been able to deal with COVID-19 and do our best to manage our daily lives. We've started to rebuild our economy, grappled with how to best educate our children, and many businesses have gotten serious about doing what they can to protect their customers and keep their doors open. Your regional health care systems are working daily to support the Low Country until we reach the end of this pandemic. And yes, we will continue to take care of our community's health in the process. Just to state it, from where we stand, the best and quickest path forward is for the safe administration of effective vaccines to everyone in our community. The challenge will be to produce distribute, and administer these vaccines to enough of us in the population. I, like you, look forward to the day when we can safely say that COVID is behind us, along with the need for masks in public, washing our hands, and social distancing at every setting. The hopeful news is that we're getting close to the approval of safe and effective vaccines, and we're starting to have access to new COVID antibody therapeutics for those who do contract the virus. Although we can now start to see the finish line and fatigue has set in, we must be careful not to stumble at the finish line. This has been a marathon. It's important to understand that the risk and potential impact of COVID has not somehow gone away. Across the nation, the virus is surging, creating another wave of infections, and we are beginning to see the numbers tick up slightly locally as well. So, I'll say it again, stay diligent. Now is not the time to let our guard down. We've learned and we have proven that we have the tools in hand needed to manage the virus. We must continue to follow through on excellent hand hygiene, social distancing, and wearing masks, protecting the vulnerable amongst us. As we approach Thanksgiving, a time for family, I understand the temptation to gather for the holiday. But we've come too far with so many people and have sacrificed too much for us to falter now. On the behalf of MUFC, I wish you all a peaceful, safe, and restful Thanksgiving holiday, and please make smart and safe decisions for yourselves, your families, and your loved ones. Thank you. Now I turn over to Councilman Mitchell.
Yes, good evening. I'm just here along with the mayor and Dr. Cole, and it's asking all residents of the city of Charleston and visitors that's coming in the city of Charleston, please adhere to the mask ordinance. So many people are dying. We are trying to keep the numbers down here low in the city of Charleston. And this is what we are doing. Because if this doesn't happen, then the city of Charleston here, the council members, we're gonna have to make some drastic decisions. And this is what we don't want to do. The numbers are growing, the numbers are growing in other states. You see people are dying in other states. This is not political. This is really what's happening here in the city of Charleston and in other states. Personally, I had people dying because of the COVID. In my family, in my church, so I know it firsthand. So this is very serious. So if the mask ordinance is helping, what we are doing helping the community, that's what we need to do to keep it going and keep the numbers down. We're not saying the mask is a cure, but it's the only thing that we have now until this vaccine comes forth. So we are asking and imploring everyone in the city of Charleston, tell your neighbors, your friends, please wear your mask. I visit King Streets all the time. I drive down King Street because I live on King Street. People are walking down with no mask on, right behind one another. It's dangerous. It's very, very dangerous. I don't want to take it home to my family, and I think you don't want to take it home to your family either. People, this is very, very serious. So we are applauding everyone in the city of Charleston, all residents in the city of Charleston, and people who are visiting the city of Charleston, please adhere to the mask ordinance. Thank you very much.
Thank you, Council Member and Mayor Pro Tem Robert Mitchell, and thank you, Dr. Cole, for your guidance from the beginning, from the very start. Dr. Cole has met with me by phone. We started out 3 times a week for months, and their advice and guidance has been invaluable to the city of Charleston, so thank you for that. So I know I spoke about the numbers already, but think about that daily average nationally. The last 7 days, it's been over 171,000 new cases per day in the United States of America. It's really remarkable how widespread the virus has now become, again, more so than the whole time. Again, I'm thankful to the citizens of Charleston for good judgment and trying to keep our numbers down. I'm saying my thanks and prayers that we can keep this up for just a few more months. We see the light at the tunnel. There is a vaccine coming. We're going to help MUSC distribute it, but until then, we can't let our guard down. We got to keep our focus on staying safe. Councilmember Mitchell is absolutely right. This is not about politics. It's about public health. Now, at the same time, if we operate safely, if we follow the simple protocols and maintain distances and wear our mask and practice good hygiene, it doesn't mean that we can't be open. We've proven that. We've kept our numbers down and our stores are open and folks are shopping, and we're going to have a wonderful holiday season this year. But we must continue to think before we give thanks and make sure that we all follow those smart practices that will keep this curve where it is right now, and that's flat.